Well, yesterday, as you know, PTO was preempted on KDKA by the launch of Jeff Bezos' Blue Origin space shuttle. Now, those of you who watched us on CBSN or the CW got to see this next story, but we wanted to make sure our KDKA viewers got to see it as well.
It's about the Pittsburgh Foundation, which works to improve the quality of life in our area by connecting donors to the critical needs of the community. They have an online fundraising event using the hashtag #OneDay, which benefits more than 200 organizations that support basic needs in Allegheny and Westmoreland counties.
Mikey Hood has more on the campaign and on one of the organizations that benefits from it, the East Liberty Family Health Care Center.
Out of our over 40,000 visits, about 20% of the patients have no insurance.
East Liberty Family Health Care Center started 39 years ago in the basement of Eastminster Church. They now have their own facility and serve thousands of people who are uninsured, underinsured, and underserved.
We provide excellent care regardless of a person's ability to pay. We provide that for everyone, whether they have the best insurance or no insurance at all. You get the same care and you're treated with dignity and respect.
CEO Rodney Jones says they offer health care on what's called a sliding scale.
A family of four who earns about $26,000 a year would only have to pay $10 per visit.
Kelly Uranker from the Pittsburgh Foundation says the services that East Liberty Family Health Care Center provides are critical.
They're serving a neighborhood that no one else really serves. So people who have health issues routinely or emergency can go to East Liberty Health Clinic and they can walk to it. Critical needs on August 3rd will cover 5 areas that we consider basic needs: childcare, transportation, healthcare, and food and shelter. So the effect on the healthcare sector has been particularly devastating. The number of visits that they have normally that were not coronavirus related goes down. And if that goes down, their income goes down. They are also reimbursed less for telehealth visits than in-person visits.
Despite pivoting to telehealth during the pandemic, patient volumes dropped, but the organization survived.
More patients are coming now because even during the pandemic, we hired more medical providers. We added specialists in psychiatry, behavioral health, podiatry, and nutrition.
With the additional funding, they will continue to serve low-income communities who they feel don't get adequate health care.
If someone makes a donation on August 3rd through pittsburghgives.org, that unlocks a match pool for any nonprofit who receives money that day. So when someone makes a donation, they can get more money in the hands of those nonprofits and therefore allow them to serve their neighbors.
We make sure that when patients need to get health care, we remove the barriers and give them the care that they need and deserve.
I'm Mikey Hood for PTO.
Our thanks to Mikey there. And the Critical Needs event under the hashtag #OneDay banner is scheduled for Tuesday, August 3rd, as she said, but you can pre-schedule your donation starting next Wednesday, July 28th through the Foundation's pittsburghgives.org donation portal.
And listen to this, every donation of $25 or more will trigger additional funding from an incentive pool of more than $500,000.
Wow.
Since 2013, Critical Needs alerts have raised nearly $8 million, and because of the coronavirus, the needs are greater more now than ever.
That's for sure.
And we also want to thank the Pittsburgh Foundation for sponsoring this segment and all the good work that they do.
Supporting all of those places, yes.
So many organizations in our area.